Basic anterior exam involves evaluation of the external components of the eye, such as the lids and position of the eye, as well as the basic anterior structures of the eye, including the conjunctiva, cornea, anterior chamber, and iris or pupil. We suggest that you routinely perform the examination beginning with the most anterior structure. This can be performed bedside or in any patient examination room with a pen light or basic direct ophthalmoscope.
We will now begin the basic anterior segment examination. So for Dr. Zhao, the first thing I'd like to do is to just have her look straight ahead again and just do an external inspection of the eyebrows, the eyelids, to make sure that the eyelids are in good position. As you can see here, that the normal eyelid position should be about 2 or 3 millimeters below the upper portion of the cornea. It's also very important to not only look to see if there's any ptosis, but also to see if there's any proptosis as well. And that's best done by looking to the side of the patient and comparing one eye versus the other eye to see if there is any anterior movement or projection of the eyeball. Once you've done a visualization of the ocular adnexa, which is the eyelids and the eyebrows, it's also very important to palpate the orbit and the eyelids. And of course, you should always wash your hands and dry them before you do any palpation. But in this case, what I'm just looking for is to make sure that the orbital rim is intact. Sometimes, please close your eyes, Dr. Zhao. Maybe I might push a little bit on the eye to make sure that I feel a nice softness and there's no resistance to retropulsion. Very good. Look straight ahead. Once I've examined the ocular adnexa, the next step is to look at the anterior part of the eyeball itself. And that's done best with either a pen light, again a very bright light source, or as I have here, a direct ophthalmoscope, which is very handy. So what I'd like to do is have Dr. Zhao look straight ahead, and I'll shine a light into the eye, and the first thing that I like to inspect is the conjunctiva, or the white of the eye. And I'm looking to see if there is any injection, if there's possibly any hemorrhage, if there's any discharge coming from the conjunctiva. It's also very helpful to have Dr. Zhao, please look up, to have the patient look up and look at the inferior fornix of the eye as I'm doing here to see if there's any foreign body, and also to look at the conjunctiva, not only on the portion of the eyeball, but on the eyelid itself. And you can do the same thing for the upper fornix by having, please look down, Dr. Zhao, and lifting the upper eyelid, and again looking underneath to make sure that the upper fornix is normal. Once you've looked at the conjunctiva, the next step is to look at the cornea. Now, the cornea is normally invisible, if you will, because it's clear, it's transparent. But if you see any white, or if you may see a foreign body, that's certainly pathology, and you want to be concerned about that and document that. Also, you may see that the cornea becomes cloudy or hazy, and that might be an indication of corneal decompensation. Once you've looked at the cornea, the next step is to look at the anterior chamber. And again, just like the cornea, the anterior chamber will be invisible to your eye. However, if you see layering of blood, which is known as hyphema, that occurs in patients with trauma, you can actually see the blood on the bottom half of the cornea, but it's actually between the cornea and the iris in the anterior chamber. If a patient has an infection, they can have layering of white blood cells, and that's known as hypopyon. And also, you can also see that by, again, looking down below towards the inferior fornix, and you can see maybe layering of white blood cells. Once you've looked at the anterior chamber, then you want to look at the iris. You want to look at the color of the iris. Also, the iris, of course, has the pupil in the middle. You want to make sure the pupil is regular and that there's no abnormality there. And again, it's very normal for Dr. Zhao. Thank you very much, Dr. Zhao.